Thank you very much, chairpersons, ladies and gentlemen. I bring greetings from India. As we all know that laparoscopic groin hernia repair has been on the scene for last more than 20 years. Yet, and there are two standardized techniques, the total extraperitoneal repair and also transabdominal preperitoneal repair. But as we have been discussing in this meeting also, and just now the chairperson commented that it is the choice of the surgeon, and more surgeons are still opting for open hernia repair. But since we have now two standardized techniques, it is time that we look at the effects of both the techniques on various aspects of groin hernia repair, and we thought it appropriate to study the comparison of testicular function following and the sexual function quality of life issues between TEP and TAPP, and also independently both the techniques. As we all know that testicular and sexual dysfunction is a concern following groin hernia repair, whether open or laparoscopic, but we wanted to investigate following laparoscopic repair, and the literature is scant in these aspects of testicular function, sexual function, and quality of life issues. The objective of this current study were to look at the testicular functions at post-operatively following TEP and TAPP repair at 3 months and 6 months in terms of testicular resistive index, testicular volume, and also hormone levels, FSH, LH, and testosterone. The sexual functions, which was evaluated by using brief male sexual function inventory, and quality of life issues using the WHO quality of life brief scale. And the groin pain was assessed using VAS score at 6 hours, 12 hours, 1 week, 6 weeks, 3 months, and 6 months. It was a prospective randomized study in a single surgical unit between November 2012 and June 2014, with a sample size of TAPP for 80 patients, TEP for 80 patients. It was a block randomization, and the study was cleared by the Institutional Ethics Committee. We used SPSS and Stata software for statistical evaluation. The inclusion criteria obviously was adult patients, primary hernias, uncomplicated, both unilateral and bilateral groin hernias. There was a long list of exclusion criteria ranging from female patients, patients with history of previous surgery in the inguinoscrotal region, recurrent hernias, complicated hernias, hydrocele epididymitis, patients with significant comorbidities, patients unfit for general anesthesia obviously were excluded, patients with uncontrolled coagulopathy, naturally one would not operate, patients not giving consent for the inclusion in the study. And almost 36% patients were excluded if you look at the consort diagram. And finally, we had 160 patients who were randomized to group 1, which was TAPP, group 2, which was TAP, and they were analyzed. Both the groups were comparable in terms of demographic variables, operative time, which was 35 minutes and 34 minutes for unilateral and bilateral repair in TEP and TAPP. Intraoperative events, we also assess the surgeon's ease of operation, dissection, and also delineation of the anatomy, particularly the triangle of doom. And we will look at the pain scores between TAP and TAPP, TEP. The pain scores were significantly higher at 6 hours, 24 hours, 1 week, and 1 month for TAPP repairs, but subsequently the pain scores merged between the two groups. So we did observe, and our previous other data also which we have published, that TAPP is associated with more pain immediate post-operatively, which merges beyond 1 month. When we looked at the testicular functions, there was no significant changes in testicular function we noted following the laparoscopic groin hernia repair in both TEP and TAPP, which was evident from mean testicular resistive index and volume, which was comparable between the two, TAPP and TEP, at all stages of the study. So there was no significant changes. Comparison of testicular volume again between the two techniques were not significantly different, and also the resistive index. Both TEP and TAPP were comparable in terms of the hormone profile which was assessed, was FSH, testosterone, and LH was not significantly different. However, what was notable was, which would we would expect also, comparison of sexual function when it was determined between, there was no difference between TEP and TAPP, but there was significant improvement in all the domains of the BMSFI in preoperative and postoperative assessment, which was in both the groups. And it was more prominent in sexual drive and overall satisfaction rate of the individuals. Again, overall quality of life when it was measured and compared preoperative versus postoperative, again in both the TEP and TAPP it was significantly better postoperatively. Otherwise, in both the groups it was no different. So in conclusion, chairpersons, ladies and gentlemen, what I would say that laparoscopic groin hernia repair improves sexual function and quality of life of all the patients. And the TEP and TPP otherwise are comparable for testicular function, sexual function, quality of life, and chronic groin pain, and also recurrence. Thank you so much for your kind attention.